Scaling dogs' teeth and why an anaesthesia-free dentistry is inappropriate and a welfare concern. We saw in the previous video how a full mouth examination is performed appropriately, and in this video we're going to show you a scale and polish. We start with scaling the teeth. This can be performed either with a hand scaler or an ultrasonic scaler. I want you to really note just how much pressure the vet has to use to remove the tartar. Realise that in an awake dog, there is a huge possibility to slip and cut the gums or the tongue if the dog suddenly moved. And that's where it can be really dangerous. The most important part of the scaling process is removing tartar from under the gum line, and this is the area where we see periodontal disease. As you can see from the video, it would be absolutely impossible to scale this area in a conscious dog. We are using very sharp instruments, and there is absolutely no way that we can prevent a tiny bit of pricking and soreness in that mucous membrane edge of the gingiva. Whether you use hand tools or an ultrasonic tool, you must clean under the gum line because this is where the bacteria lurks. Now I just want to quickly remind you how tartar is formed. Our pets' mouths are absolutely full of bacteria, and it doesn't matter what the diet is, whether it's a kibble diet or whether it's a raw diet, bacteria is still present. When this bacteria or plaque biofilm that sits on the tooth, it sits really around the gum line and in between teeth. And when it isn't removed, it hardens over time, and this is due to reactions with the minerals that are found in our saliva. This biofilm sits on the tooth, and unless it is regularly brushed off, then basically it hardens and we get what's called tartar or calculus. The plaque can be colourless, so teeth can look really clean and white, yet have a significant plaque build-up. And that's why humans brush twice a day and have 6 monthly checkups, and why we recommend the same for our pets. So the final aspect of cleaning the crown is actually polishing the teeth. And the act of polishing removes any small divots or grooves that the scaling caused. This leaves a completely smooth surface on the tooth, which then discourages any plaque or bacteria from actually adhering and hopefully prolonging and preventing the buildup of bacteria that can then develop into tartar. It's really important to get in and polish underneath the gum line as well, because as we just said before, that is where bacteria lurks and lives to hide, and it's where periodontal disease starts. So that, people, is scaling and polishing.